Hello, my name is Ori Solomon, and I'm a supervisor for the projects and partnership team at the Global Health Next Generation Network. I am from Toronto, currently living and working in Edinburgh, Scotland. So Elena Marban, who is the current chair of the Global Health Next Generation Network, gave a seminar to the Masters of Global Health cohort back in 2018-19 at IS Global when I was a student there, and I thought it was a great initiative and something I really wanted to be a part of. So I'm currently working as a lab technician at the University of Edinburgh in the Department of Infectious Medicine. So my career path has kind of been winding and has been very academic heavy so far. So I started out with a bachelor's degree in medical sciences with an honors specialization in microbiology and immunology. I'm not entirely sure how it happened, but I found myself gravitating towards global health, took a course in my undergrad and completely fell in love with the field. After being accepted to a master's in global health at IS Global in Barcelona, I decided I wanted to focus on infectious diseases, and antimicrobial resistance became my calling. I spent the year researching policies and action plans to tackle the issue. I noticed that very frequently there was an emphasis on the importance of rapid diagnostics and the lack of funding and solutions in the field. So I decided to pursue rapid diagnostics in antimicrobial resistance. This led me to my current position in a lab researching biosensors and rapid point of care diagnostics for infectious diseases and antimicrobial resistance. So I think the secret to applications, and I mean, it might be a little cliche, but it's focusing on why rather than what. So why you did what you did rather than what you did. I mean, of course, you want to have super impressive positions, grants, awards in your application, but more importantly, it's explaining the significance of what you have. So in my opinion, every experience is kind of neutral, and it's up to us as the applicant to show the employer, adjudicator, whoever, why it's not only a good experience, but a crucial one, and how it strengthens you as a candidate. And to build an application, you have to have experiences in the first place. So take opportunities when they come your way and do your best to use them in a way that allows for what you need. So my ultimate goal is to pursue research and advocacy in antimicrobial resistance and rapid point of care tests for infectious diseases. I'm currently gaining great kind of fundamentals experience on what happens within the research pipeline and the difference between industrial and academic research and where they meet and where they differ. I'm hoping all this will give me the experience and knowledge to be able to advocate effectively, to empower political establishment and scientific communities to invest more heavily in this very urgently unmet gap. So first of all, I'm a musician, so I play the violin. I've played it for 20 years, so that's definitely an area of interest. Academically, or more relevant to global health, aside from antimicrobial resistance and point of care diagnostics, I am very interested in social determinants of health. I'm very interested in the field of immunology and autoimmune diseases, and autoimmune disease epidemiology is something that very much interests me, as well as policy work I find very relevant, very interesting. Yeah, this one's tricky. Global health to me is the intersection where science, health, policies, and diplomacy kind of converge to make the largest impact on the largest scale. So specifically at the moment, there's definitely a shortage of rapid point of care diagnostics. This has been made blaringly apparent by the COVID-19 pandemic. So I hope that out of this tragic pandemic comes a more aware society that addresses these unmet gaps in preparedness and in health in general. On a personal level, what I personally contribute, gaining experience, what I personally bring to the greater picture, in gaining experience in diagnostics research and development will give me more knowledge in a new facet of battling the rise of antimicrobial resistance, as we as a society are, or at least should be, preparing to fight off and mitigate future pandemics and disease outbreaks. I think advocacy is about understanding as many sides of the same issue and finding ways to bring them together. So I'm immersing myself in one vital side of this specific topic. Do it, go for it. If you have any idea what you want to do, absolutely go for it. Get in touch with people in the field, talk about your ideas, your thoughts, your solutions, your questions, to people in the field, to friends, parents, anybody. Just make yourself heard. You will find someone who wants to hear them and wants to listen. If you're unsure of what you want to do, read, listen, watch, keep your ears open. My initial thought was, what interests me? I found that question had too many answers to kind of be able to narrow that down. So instead I asked, based on what I know and what I have, where can I contribute most? And I found that helped get me started. It wasn't the last question I asked myself. I have a lot more questions for myself, that's for sure, but it definitely helped get the ball rolling. Moving from Canada to Scotland brought me very close to Europe, and I would love to be able to thoroughly travel through Europe. It's been less feasible, but hopefully soon enough. I have a list of 5 cities spread through Central and Eastern Europe, Central and Western Europe, and some in Eastern Europe as well, that I'm really looking forward to visiting. That could be a whole video on its own though.